right, we are here with Dan Wilson, CEO of Moxe, and we're here to ask you a few questions. So the first question we have for you is, what's something that not enough people are talking about in healthcare?
So I think you walk around the hall today, everyone's talking about interoperability. I think what they're not talking about is interoperability doesn't mean any one thing. Interoperability is really just a philosophy. And so it's this philosophy that data should be available. But until you start thinking about the actual underlying use case, the constituents, what they're trying to solve for, you can't make the data usable. You can't actually start to unlock value. And so what I'd love to hear people talking more about is what are they actually doing on top of all this data interoperability? What problem are they actually solving? Who are they solving it for? And why should any of us really take notice? We've been talking about interoperability as a concept for decades. And, I want to hear about what people are doing to solve real problems.
Great. And then, I don't know how long you've been in healthcare, but what is it that got you into healthcare and what keeps you excited about it?
Yeah, so I've been working in health IT for 15 years. What got me into it originally was actually was working at Epic. So I was going to go into finance, realized I actually didn't really care about finance. And this idea of working in healthcare, even though I didn't understand what it meant, was very compelling. What has kept me in health IT is the scope of the problems. I love solving problems, and these problems just have so much meaning behind them. They affect so many people, and I find they're very challenging, they're convoluted, it's messy, and I am drawn to those types of problems. On top of that, like when you think about the problems in healthcare, so more specifically what keeps me kind of going is the cost problem. So healthcare, we talk a lot about triple aim, quadruple aim. In my personal opinion, we don't really have a quality issue and an access issue if you have money. What we have is a cost issue, and we have those other issues for people who cannot afford to get access to our system. And so what keeps me going is kind of the pervasive overspending of money or the misallocation of spending and trying to make some dent in that.